Hypercoagulability is the kind of coagulopathy where there is an increase in the coagulation. There is increase in the formation of the blood clot and the flow of the blood is obstructed. So this is the condition that is opposite to increase in the bleeding. Now, there can be various reasons that can lead to the hypercoagulability or increase in the platelet activation, increase in the platelet aggregation and the formation of the blood clot. Even when there is no injury inside the body or there is no intravascular or endothelial injury, there can be the formation of the clot that can lead to the hypercoagulable state. Now, there can be any underlying disease behind this hypercoagulable state, or there can be any other reason that can lead to this kind of the disorder, like the inherited one. So let's see that what can be the different causes that can lead to the hypercoagulability. There can be the inherited causes in which there can be the activated protein C resistance, that is basically the factor 5 lead-in deficiency that is leading to the hypercoagulability. Then there can be the antithrombin deficiency. Antithrombin is basically very important when you have to block the thrombin. Thrombin is important to activate the fibrinogen to the fibrin. So in order to oppose the coagulation process, this antithrombin is very important. So when antithrombin is deficient, so obviously there can be the hypercoagulability, because the balance that is present between the coagulation and the bleeding, it will be disturbed. Then protein C deficiency can also be a reason of the hypercoagulability. There can be the protein S deficiency, dysfibrinogenemia. Now, all of these are basically the things that are controlling the blood clotting. They are basically deficient in the patient that are leading to the hypercoagulable state. Then there can be the acquired causes that can lead to the hypercoagulability, including the lupus inhibitors. There can be the malignancy, nephrotic syndrome can be a reason. There can be the therapy factor concentrates. Heparin is another reason that can lead to the hypercoagulability. Then there can be the oral contraceptives, and hyperlipidemia can be another reason. And at the end, there can be the thrombocytopenic purpura that can lead to such kind of the disorders. Now, all of these conditions, whether they are inherited or acquired, they are basically because of the disturb in the balance of the bleeding and normal flow of the blood. So whenever there is increase in the formation of the blood clots, that will block the normal flow of the blood, and that will obviously affect the normal or proper functioning of the organ to which the artery or the vein is supplying.